The reason that it's not a popular question in this election, or in any election, either federal or provincial, is that it would be political suicide to put into effect what has to be done to not so much maybe curtail the opioid crisis, because there's so many different layers, but definitely to affect the outcome and the deaths that we're having from the outcome. Your average person in suburbia doesn't think it's going to happen in their backyard. They see it as being a inner city problem. There are some platforms of the parties that are better than others that are willing to comment. The Green Party is actually talking about prescription grade heroin and using that for a substitution. That's the only party I've heard that has suggested that. NDP have said, well, that's something that they could look at and consider. And the Liberals are talking about opioid replacement therapy, not necessarily using the medical grade heroin. I think that we need to reduce the number of fatalities, overdoses in the province across Canada, is that we have to be proactive and not reactive, which is what we are now when we're using naloxone to treat an overdose. We've got to get it before it gets to that state. The solution really has to come from the federal government. And the solution is that we have to decriminalize drugs and have clean, safe drugs for our users. That is very unpopular, and I think we're probably, unfortunately, a few years away from that. But in the meantime, it would certainly help to have other treatment options. Treatment, education, and care, health care for them.